Honorable Padma Awardee, Dr. Anurag Batra ji, Swadeep Srivastava ji. He is very close friend of mine since long. When I was member of Medical Council of India and I was working in the IMA, at that time, Dr. Swadeep Srivastava was very close. Ravinder Singh ji, dignitaries on and off the dais and participants. I am honored to be here to address the august gathering who have assembled here to discuss Indian healthcare. COVID pandemic has left a distinct footprint in the healthcare dynamics, not only in our country but across the world. Such pandemic were not seen in recent past. A similar pandemic, Spanish flu, was witnessed in century ago in 1918, which affected around 500 millions people across the globe and death of all the nearly 100 millions. The present generations was not a witness to the catastrophe. The remaining epidemics and pandemics like Asian flu, swine flu, Ebola, and AIDS made the healthcare industry and medical professionals to get equipped for similar catastrophe in future. COVID pandemic hits us like a bolt from the blue. The entire world was captured by this deadly virus in a matter of few days and brought to stand still entire development of work across the globe. At the outset, none of experts predicted that the pandemic will be continue over 2 years. India has seen 4.43 crores COVID cases in the last 2 years, with early 5.27 lakhs deaths. The effort taken by the government with the Honorable Prime Minister Shri Narendra Modi ji leading from the front of laudable. I would like to put on record the Indian Medical Association, with the entire members across the country, stood firmly with the government, not only implemented and guidelines issued by the government, but also actively participating in decision making and guiding the government regarding appropriate COVID care and management. The citizen of the country will always appreciate and remember the contribution of the medical professionals, nurses and paramedical during the COVID pandemic, who served the public risking their own lives. Many a times, the healthcare workers had a limit to remain out of their houses for weeks and the months to avoid carrying infection to home. The pandemic gave an opportunity to the doctors to rebuild that trust and faith among the general public. The second wave of the COVID pandemic expressed the unprecedented of our healthcare system, both in public and private sector. The lessons learned in the first wave and the indicators left behind in different countries regarding the severity of the infections and after effects were not considered adequately and put into practice, leading to hue and cry among the public. Having said that, COVID pandemic has left us with possible impact among the healthcare delivery system in form of development in human resources management, material management, supply chain management, patients transfer management, environmental health management, nutritional management, etc. This gives us opportunity where the main manpower in the public sector and private sector would work in coordinations in domestic manufacturers' capacity of medical equipment and consumables increased drastically to meet the unfrozen demand. The pandemic extended our ability of the entire organizations, coordinations, training capabilities, information and communication skills. The pandemic has further enhanced our responsibility to manage any such calamities and disasters with a confidence of positive outcome. A new model of healthcare delivery will seen emerging with more emphasis on public health in volunteers and preventive measures, telehealth, and dependence of digital technology. It may also be responsibility of the government as well as the private sector to increase the surge capacity of the infrastructures, including better sense, diagnostics, availability, and medicines, oxygen supply, and transportations. I am sure that the Indian healthcare in public and private sector is always prepared to face any eventuality to such magnitude in coming years. The lessons learned in the COVID pandemic in the form of COVID appropriate behavior will be routine practice among the public just as if universal precautions learned during AIDS pandemic has become a regular practice among the healthcare workers. With these few words, I would like to end the address with a positive note that the futures of the country will be safe in the hands of dedicated medical practitioners, healthcare sector, innovators with the aim to achieve quality of affordable healthcare for all. I thank of organizers for inviting me and giving me the opportunity to share my thoughts. Thank you, Dr. uh, Anil Goyalji, who has come with me. He is a very active uh, leaders of the IMA. He is a treasures of IMA. He would be very soon very good. Uh, Thank you very much, sir. Thank you, sir.